A medical breakthrough in seeing and treating veins. Up next on Comcast Newsmakers.
Bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hi, and welcome back to Newsmakers. A new device uses infrared light to image red blood cells, allowing a video camera to capture the image through a computer and project them onto a patient's skin. Here to discuss the implications of this new technology is this hour's newsmaker, Dr. William Julian. Thank you very much for joining us.
Thank you very much for having me.
Now, what is this process called?
The vein viewer is a machine that allows you to see the veins under the skin using the infrared heat from the red blood cells. And so instead of seeing with your eyes the veins you can see on the surface of the skin, you can actually see deeper and see some of the deeper veins, so that when we're doing sclerotherapy, we can target the deeper veins that supply the spider veins and reticular veins on the surface of the skin, and more safely and quickly target these vessels and ablate them.
We have a picture of that right now. When you talk sclerotherapy, you're talking about the spider veins and varicose veins, correct? And you correct them from their source. Exactly.
So if you just inject the spider vein, you don't necessarily get the vein that is supplying the spider veins underneath, the reticular vein. This vein viewer allows you to see that vein deeper in the skin and target it, so you'll have a more effective and durable sclerotherapy.
And you see that happening right now. Now, it's interesting. This is not just aesthetic surgery. This is really good for your overall health and your circulation.
A lot of people with spider veins and reticular veins have significant discomfort and pain, and this will sometimes help relieve that. There's also a bigger problem of venous insufficiency, where we actually have big varicose veins that we sometimes need to treat. And in those patients, it can actually be so bad that they'll have ulceration on their skin, and sometimes the varicose veins bleed. And so we don't use the vein viewer for that, but we have other techniques, like a procedure called endovenous laser ablation, where we ablate the deeper varicose veins with a laser rather than stripping them out surgically in the operating room. So this whole field of venous insufficiency, varicose veins, and spider veins has a lot of new minimally invasive treatments that we just do in the office under local anesthesia.
Now, the vein viewer is not only used for this particular context, but also Homeland Security is taking a look at it.
It's a breakthrough technology, and it's one of those, it's a new device that people are finding uses for. So, for instance, if you have a patient that you can't get an IV in or draw blood because they've had chemotherapy, for instance, you can oftentimes find it with the vein viewer. Like you referred to, everybody has their own specific vein pattern, and so you can use it to document and recognize people, and Homeland Security has talked about using it as a sort of fingerprinting type device.
So everybody's veins are unique to them,
exactly.
And it's like a fingerprint.
Yes.
In what manner? In the way that the veins are actually
just
patterns?
The pattern. It's like a snowflake. Every snowflake is different.
It's interesting. I had no idea that everybody's vein pattern was different. Now, when you see this happening, how did this come about, this brand new technology? Was it something that people designed because they were looking for something to help them all?
No, I don't recall the exact story, but the device was in a professor's office, and he was going to use it for a particular reason, and it didn't work for that. And one day he was telling his friend about it, and the friend said, well, I don't know if it's going to work for that, but I can sure see my veins well. And with that, they came on the idea that maybe we should use this new technology to image veins. And so they built the vein viewer, and it's now being distributed. I think there's 6 sold in the United States. We have the first one in Florida.
Congratulations. That's phenomenal. A lot of great discoveries are happening just by accident, aren't they? This hour's newsmaker has been Dr. William Julian discussing the vein viewer, a new device used to see and treat veins. I'm Spiro Kenton. Thank you for joining us.
The preceding has been a presentation of Comcast Newsmakers. And now, back to CNN Headline News.